Hey guys, it's Dominique, and I'm here with another online lecture for your theories class. Today we're going to continue with talking about community and group models, and we're going to focus specifically on social marketing today and the ecological models of health behavior. Now, social marketing is one of those areas where, and we've talked about some others in the class like that, where it's not like one particular theory or one particular model, but more an approach, a framework that helps to guide us with unique ways that we can meet large groups of people at the same time as we try to promote our public health initiatives. And the ecological models of health behavior, you might recall we mentioned briefly in our first class together, but we'll talk about that in a little bit more depth today. So let's get started. Now, in our last class, I just want to refresh your memory of what we were discussing. We were focusing on diffusion of innovation theory, and we talked about how diffusion is really just the degree to which one of our programs or interventions or policies is integrated across a system or across a community. And we talked a lot about the different types of people that are along the innovation curve. So we talked about innovators and early adopters, early majority adopters, etc. And then we also had a conversation about a framework called precede proceed, which is very much a way to facilitate theory application in our programs and evaluation right from the beginning to the end. Today, we're going to be moving on to social marketing and ecological models only. So let's get started with social marketing. One way to start thinking about social marketing is to think about commercial marketing. And if you think about over the past few days, an item that you might have purchased, first think about where did you buy this item? What did you buy? Where did you buy it and why did you buy it? And chances are, if we were to discuss this together in class and I asked you to tell me something that you bought, there might be some people who bought articles of clothing or some people who bought takeout food or some people who bought maybe even like some sort of an electronic something that you needed or a new adapter for your phone. And the common things that I hear most often that come up for why people bought these things include things like, well, it was just convenient. I happened to be walking by, or I saw that something was on sale, so the price was right, or this is something that I've really been needing. I've been looking for it for a long time. And so these different issues would come up related to not just the item, but very much having to do with like the placement of the item, so where it was placed in a store or how you noticed it when you walk by, the price of the item, the convenience factor, and all of these different elements that influence why you bought that particular item. Now, I want you to keep this in mind because we use very similar strategies when we try to get people to adapt not just items, but behaviors and services that we offer in public health that we think can be helpful. The definition of social marketing is simply just the use by public health advocates of these kinds of marketing concepts and principles and methods that we take from commercial marketing and then we apply to design health communications and health promotion programs. The main differences between social marketing and commercial marketing, however, cannot be ignored, and they are significant, so let's review them now. One thing that's unique about social marketing that's very different than in commercial marketing is that social marketing is aimed at improving personal or societal welfare. So as commercial marketing, a company is only aimed at making money. If there's an element of social marketing, there is this extra layer of interest in improving one's welfare or the welfare of society or community. So that's unique to social marketing. Another thing with social marketing versus commercial marketing is that social marketing looks to have some sort of an interaction between the marketer, whether that's a public health person, an organization, or even a for-profit company, and the consumer in a way that's going to be mutually fulfilled the needs. So we're going to fulfill the needs that the consumer has and we're going to fulfill the needs that the marketer has, but we're going to do that in a way that's not just sort of one directional of let's just make more money, but to go back to that previous point, let's also help people's quality of life. Another thing is that when we look at our return on investment in social marketing, we're not simply looking at dollars made as you would in commercial marketing, but we're really instead looking on, what's the cost of this for an individual to engage in this health issue or this problem? And then how can we share the benefits of that? Are we improving their overall health? That's the main goal here. Another thing that's unique is that whereas commercial marketing tends to target people who would have more money, obviously because they are looking for people who have money to spend on those items, in social marketing, we're often targeting people who have health disparities, often people who can't afford to buy products, but who we know need our public health services. In commercial marketing, often we find that marketers are dependent upon us as consumers not being fully informed. Our lack of information sometimes can help fuel us to buy certain products. But in the case of social marketing, we really want to have an audience that is fully informed about the risks of not adopting our product or services, the value of adopting our product or services, and understands their own level of severity and susceptibility, to harken back to what we were talking about with the health belief model. There are a number of potential applications for social marketing, and that's really why it matters and why it's so popular. So let's talk about the potential applications of social marketing. Obviously, number one is promoting health behavior, but often we're looking to promote services, like maybe we're offering a service that our patients just aren't taking advantage of, or our clients or our potential audience is not taking advantage of, that we know can be really helpful. Sometimes we want to increase utilization rates of a particular, maybe a screening service or a vaccination or something like that, or even a program that's available. So for example, I was working on a capstone project with a student who was really interested in the use of patient navigator programs to increase breast cancer screenings and interactions with physicians related to breast cancer screenings. And so the breast cancer prevention program at Penn Medicine asked her to do some interview work to help find out why more people in their target audience weren't utilizing their patient navigator services, which could be so valuable for helping people to figure out how to access healthcare services and how to navigate the system. Sometimes social marketing is used because it can also help us to improve customer satisfaction. In other words, we can target different groups of social marketing and get their feedback so that we can continue to create products and services and opportunities that are going to be more in line with their individual needs. And of course, social marketing can also be used to enhance compliance with certain regulations or recommendations that we've gotten from the CDC, the NIH, or the World Health Organization to help improve overall health. Now, the reason why social marketing is so popular for being able to meet these goals, because we've been talking all semester about different theories and frameworks that we can use to help us meet these goals, right? So why is it that social marketing is often such a popular method for doing this? Primarily because we know it works. It works by bringing about behavior change, and there's lots of research to back this up. And although social marketing programs and social marketing campaigns are very expensive to put out, they're also very cost effective because they help us to reach large numbers of people at once. So whereas in our other some of our other theories and frameworks that we've discussed, we're really targeting one person at a time or two people at a time, or maybe just a small group. Social marketing is meant to target the masses. And what that means is if we can throw this out to the masses of people, we increase the shot that we have of these individuals coming back to us and using our services or using our products to help their overall health. Now, when it comes to the basic principles of social marketing, it's important to me that you're clear about these before we start talking about the practices. So let's first start talking about the principles. Think of these as sort of like the concepts or the constructs within this framework. So the first principle, basic principle of social marketing, is that social marketing is focused on behavioral outcomes. We're not focused on just increasing awareness, although sometimes social marketing campaigns will do that. But we're also often focused on maybe changing attitudes or opinions or somebody's overall intention to, obtain some sort of a preventive screening measure or something like that. But ideally, we're looking for outcomes that we can define as behavioral change to know that our program worked. So did these people quit smoking? Did they get a mammogram? Did they start using condoms? It's very outcome focused as opposed to some of our other theories and frameworks, which are less focused on having to have a firm outcome. Social marketing, one of the ways that we know that social marketing programs work and one of the ways they get measured, social marketing programs are really looking for these behavioral outcomes. So that's a key principle in social marketing practices. Another is that consumer benefits is our main priority. So we're looking to have some sort of a fundamental benefit to the members of our target audience or even to society as a whole. And of course, the most common thing that we talk about in social marketing, a basic principle of social marketing, is that it uses marketing perspectives, duh. So we think about these marketing perspectives that we get from commercial marketing. And then what we do is we try to match these to the needs and the benefits and the values and the desires of our target audience so that we can be better equipped to get the messages out there in a way that's salient, in a way that's meaningful, and in a way that they may be more likely to respond to. In order to help people to respond to our social marketing messages, and in order to increase the likelihood for that behavioral outcome that we're looking for, we use a combination of strategies in social marketing, strategies that are referred to as downstream strategies or upstream strategies. Downstream strategies are typically focused on addressing individual barriers to change. So understanding somebody's knowledge level or the skills that they might have or that they might lack could be important to helping them to adapt our particular product or service. But upstream strategies are also really important. This is where we look at the broader social factors that influence somebody's decision to be able to engage in a particular health outcome that we want them to engage in, or some sort of a service, or to work with a product that might help them in their overall health. And so in social marketing, we use a combination of these. Sometimes marketers also talk about the 3 E's: engineering, education, and enforcement. And this, again, combines these downstream and upstream strategies. One example of this is the use of seatbelts in cars. So the engineering component is we have to engineer something that we know is going to be helpful for society at large and make it accessible to everybody. So in the US today, there are seatbelts in every car because it's a law that you have to wear a seatbelt. But even in the early 80s, not everybody was wearing seatbelts. And certainly in the 70s, there were still cars that were being made without seatbelts. So in order to change some of our public health behaviors that we get from our audience, we first have to engineer something that's going to help them. The next thing we have to do is we have to educate them about the use, why it's important. How can that seatbelt help to save their life? How can it help to protect them in an accident? There are still many people who don't wear seatbelts. There are still many people who believe that if they wear a seatbelt, they are going to be more at risk for being injured in an accident. And let's face it, we know that seatbelts can injure people in accidents. But we also have enough research to support that the majority of what we get out of seatbelt use is safety and protection of our health. So it's important that we educate people, not just about the importance of seatbelts, but also about the proper use of seatbelts. Because when seatbelts are worn improperly, they don't work effectively. And another thing we do is enforcement in public health sometimes. So in the case of the seatbelt example, if you get pulled over for speeding and a police officer identifies that you're not wearing your seatbelt, we know that police officer can issue you a ticket, right? You get a ticket if you fail to use your seatbelt. And unfortunately, this is not something that's we see sort of across the trajectory of public health issues, right? We can't always have this level of enforcement coming from like a law, but we can sometimes have enforcement that comes from other areas that can help influence the likelihood that somebody will continue with a particular health strategy. And so whenever we're thinking about this in social marketing, we're told that we're using the 3 E's. Now, probably the most commonly recognized principles that we know that are used a lot in social marketing have to do with the 4 Ps, which if you've taken any marketing classes as an undergrad or in another graduate program, you've inevitably been exposed to these, and you might even have just been exposed to them, from your own experiences. And the 4 Ps are marketing strategies which look to enhance effectiveness of messages by considering the 4 elements of our message that we need to get across, which are product, price, place, and promotion. So let's talk about these a little bit. When we're talking about a product in social marketing, what we're discussing here is how are we packaging or labeling our messaging? Are we doing that based on physical, economic, social, or psychological benefits to enhance appeal? And ideally, we're thinking about all of these things. In other words, like, what's the product? What are you offering people? Sometimes it's a service. Sometimes it's a behavior change. Sometimes it's a commodity or a tangible good that we believe can help people in their overall journey to better health. For example, when we refer to low-fat dishes on a restaurant menu as being heart healthy and we label them as such, that's considered the product. The product is the heart healthy dish. And we could talk about a number of different ideas for products. And when we do our recap slides together as a class, we can think about some of the different strategies that get used here, examples that you might be able to bring to us of where you've seen sort of this idea of product as it relates to public health. Of course, another element that we include is price. And this is a little bit different than just what we think of in commercial marketing with price, because when we're talking about price in commercial marketing, we're talking about dollars spent. How much money typically does it cost for somebody to buy this service or this good? But when we're talking about this in social marketing, we're talking about it a little bit more broadly, right? Where we're considering what are the pros and cons that somebody is going to be calculating in their head that's going to help them figure out the cost of adopting the product or behavior. And if you think back in your head to the trans-theoretical model, when we talked about these issues of decisional balance, of course, this definitely comes up here in this issue of price, because sometimes it's a money cost, sure, but sometimes it's the amount of time it would take somebody to engage in a particular health behavior or with a particular service, or pleasure that they gain from having unhealthy behaviors that they would then have to give up, or loss of self-esteem or pride, or embarrassment by taking part in whatever this health initiative is that we're putting out there. So we have to be mindful that when it comes to price, the price isn't just financial. The price really has to do with some of the psychological costs that people might experience when engaging with whatever our product is. Of course, the next P is place. And place refers to what channels are we using for helping our audience to access whatever our product is. And we really think a lot about how can we increase the level of convenience for this. So, when we think about, for example, some of the initiatives that have come up recently in our corner stores in Philadelphia. So this is an initiative that's happening across different cities, but Philadelphia is really laying the groundwork here, where we're noticing that because we know that people spend so much money on corner stores on unhealthy foods, processed foods that don't do them any justice for their health. There are initiatives now to try to increase placement in these stores for healthier items. Again, if you think about, we talked about behavioral economics, this is really like choice architecture. So place in social marketing is, how do we not just determine where we're going to issue our message or service or our product, but how can we make that very easily accessible to increase reach? So sometimes we think about elements like choice architecture, and sometimes we think about the different channels that we might use to communicate a message and how that might differ from group to group. Some of the things we consider when we try to decide what the right place is to issue a social marketing message are, what are the individual factors that we need to take into account from our audience? Like, what's the overall knowledge of skill? What's the overall knowledge of the product to begin with? What are the environmental factors that influence their access to a particular place where we might promote this message? Where is our service provided and where is the information received? Where is the tangible product going to be purchased if there is one? Is it easily available? Is it easy to find and use? Is it appropriate for our audience? How much time will it take for them to access it? And are we promoting it in a timely manner? So all of these things get determined or get considered when we determine the channel that we're going to use to access our audience and to promote whatever our messages may be. Promotion refers to the overall design campaign. How well are we matching our campaign to the characteristics of our audience? What are the design elements that we need to include, right? So this is like, what type of appeal do we want to make? Do we want to make an appeal that's like uplifting? Do we want to make an appeal that's foreboding? Do we want to consider scaring people and then go like with a fear appeal? What kind of a tone is our social marketing campaign going to take? And is there a spokesperson that we can think of that might connect well with the audience? A lot of social marketing campaigns use spokespeople. And that's because they're looking to find somebody with whom the audience is going to feel a level of connection and think, oh, if this person is promoting this message, surely this is something that I need to pay attention to. So we consider truth campaigns and sort of industry manipulation that sometimes happens across commercial marketing versus what are the health consequences that we're really concerned about in social marketing. And we look to balance all of these elements together. Now, a lot of times people ask, where does social media fit into all of this? And social media and social marketing are not the same thing. Social media simply provide a vehicle, right? They provide a channel, a place in which we can put our messages. But social marketing is really, what do you do with your messages? What do you do with that vehicle? So we can use social media as a channel, but social marketing is, what are we doing with that channel? What messages are we putting out there? How can we reach people in unique ways? How can we promote this? One of the ways that we do that, another key principle in social marketing, is through a practice called audience segmentation. Now, with audience segmentation, what we're really looking to do is increase the personalization of our message. Because if you think about it, I mean, this is sort of intuitive. We know that there's no real benefit from coming up with a one-size-fits-all campaign or message because people are different, groups are different. So what we do with audience segmentation is we look at different ways that we can narrow our audience based on maybe specific demographic factors or factors that we know about their level of knowledge or use. And then what we do is we vary our messages accordingly. And in order to do that, that might mean that we use different messages or different content or different channels across these various subgroups. So imagine for a second that you were looking to have a social marketing campaign about increasing safer sex practices. You would not use the same campaign materials, the same messaging, the same, campaign posters or commercials. You wouldn't use the same ones for middle schoolers versus high schoolers versus people who are middle-aged versus people who are living in a senior living facility, versus people who are heterosexual or homosexual or experiencing homelessness, right? You would think about, what are the different needs for these groups? What's age appropriate? What's tailored? What channels do they use? What resources do they use for getting their messages, right? So maybe when we're thinking about middle schoolers, we're not including quite as much detail on the overall message, but we are talking about safer sex practices. We might be talking about, self-esteem issues and body conscious issues. And we might think about putting these messages in their schools. We might think about having these messages in social media on the kinds of platforms that we know that they use most often, like Snapchat and Instagram, which we know are kind of used by some of the younger folks. Versus if we were to talk to maybe, college freshmen, and we would have very different kinds of messaging related to safer sex practices. And we might still use some of our Snapchat, but now we might want to also use Instagram or Facebook for our social media. We might want to have posters around the dorms. We might want to have different sort of programs on campus. Now, you might not know this, but safe sex practices is actually a real big issue for people who are living in senior living homes, retirement centers, skilled nursing facilities, because HIV continues to be a problem for these populations who are lonely and still interested in having a lot of sex, right? And so the messages that you give these folks is obviously going to be the messages that are different than the middle schoolers or the college freshmen. And so we're talking about audience segmentation. What we mean by that is we want to take this very large heterogeneous population and we want to break it down into smaller, more homogeneous populations so we can figure out what are the unique strategies that we need for reaching them? What are the unique messages that we need? What are the unique channels that we need in order to reach these subgroups? Put simply, we're looking to identify targets of opportunity. We're hoping that our different subgroups can respond to the same offer. So the messages that we use for one college campus, we can likely use for another college campus. But we wouldn't likely use those messages at a middle school, for example. And then we can design interventions that are effective for each particular segment of our audience. Social marketing practices are really widely used, and one of the resources that I like to give you an idea about some cool different social marketing campaigns that are out there is actually available right on the CDC's website. So if you want to get some ideas for large-scale social marketing campaigns that have been proven to be exceptionally effective, consider checking out the CDC's website and look at some of the campaigns that are out there. Now, there are 3 different approaches generally that our social marketing practices and campaigns might fall into. The first is the product-driven approach. The second is a consumer-driven approach. And the third is a market-driven approach. And I would like to give you some concrete examples to help you better understand each of these approaches in social marketing. So a product-driven approach is focusing on the appeal or the uniqueness of a campaign product. And it's usually heavily branded. The goal in a product-driven approach is that we're highlighting positive associations or expectancies between a campaign product and something that we think is really going to help people. Now, I'm showing you some examples now, and I apologize that the image quality isn't the best, but I'm showing you some examples now that I really like from the Stretch Your Dollar canned food campaigns. In the early 2000s and also in the 90s, but especially in the early 2000s when we hit a pretty deep recession again, there was definitely a need for people to start stretching their dollar when it came to food. And we know that there are millions and millions of Americans and American families, an average still I think of 1 out of every 7 or 1 out of every 8 families in this area who are receiving SNAP dollars to help fund their food, meaning they're part of the Supplemental Nutrition Education Program, food stamps. And one of the things that came out of this recession was a really strong need for people to get more out of their dollar, really, when it came to buying food. So Del Monte and Campbell's both came out with these campaigns that were very product-driven to emphasize the value of canned foods for doing that. So on the left, you see this Del Monte ad that shows this, this thing of peas, sort of like the evolution of the peas in the can. And it says, "Are you looking to stretch your food dollars? Pick Del Monte canned peas over the leading frozen brand, and without sacrificing taste or nutrition, get a whole lot more for the same sweet price." So that's an example of a company that, again, we're not saying that these are not profit-making companies, but all of these companies are still kind of tying into a little bit of a social marketing campaign here, because the goal is, sure, while they want to make money, there was really a big push to help Americans eat more healthy foods. And while some might say to me like, oh, canned foods aren't healthy foods, actually a lot of canned foods are very healthy, and it's about just getting low sodium or no sodium options. And they provide a great opportunity for some people to get vegetables that wouldn't otherwise be able to afford them. On the right-hand side, you see this ad from Campbell's. You think $1 isn't what it used to be? It still buys more than 20 servings of Campbell's tomato soup, less than 5 cents a serving. Good. Now, obviously, we can make the arguments back and forth that Campbell's tomato soup is somewhat high in the sodium and not necessarily, the best option. But when you're the type of person who's really struggling with your food dollar and looking for something to eat, soup is very filling. And so, again, this provides an example of this product-driven approach where we're looking at a highly branded item and we're looking to link positive associations with the product. So the positive association is I can stretch my food dollar and I can eat something that's nutritious and going to fill me up with this particular branded item. Let's talk next about consumer-driven approaches. Consumer-driven approaches go beyond just the product, and they also incorporate an element of social norms. They consider the perceptions that others might have related to this behavior and how others also factor in the larger perception from society, from their friends, from their family. So these tend to yield more lasting effects with members of the target audience because they try to facilitate a system or a community to really not just take a branded item, but to then almost create a level of, not peer pressure, but to really appeal to the person's sense of social norm and duty to be part of a community and be sort of consistent with what's happening, across their environment. So I'm going to show you two examples of short commercials that really dive into this consumer-driven approach. And again, could we have examples that are just strictly from public health campaigns? Sure, but they're a little bit harder for people to wrap their heads around. So I'm giving you examples from what I recognize are profit-making companies, but they're using some of these social marketing approaches. So I'm going to give you two examples from the consumer-driven approach. And the first is an ad from Weight Watchers that I found from a few years ago that I like because I think it hits this idea really well. And we can talk in a minute about what that is. So here we go.
I'm Jessica Simpson, and yes, I'm doing Weight Watchers. There is a lot of pressure to lose weight, but I'm not a supermodel. I'm just Jessica, trying to eat real food in the real world, and I really just want to be healthy for my daughter. So I knew Weight Watchers was the only way to go. It's working. I'm on my way, and it feels amazing. Really, I just want to be a better version of myself. Join for free, you'll see. Weight Watchers, because it works. I'm Jessica Simpson.
Okay, enough of you, Jessica. Okay, so what you're seeing in terms of, what are some of the social norms that are presented in that ad? What are the perceptions that they're appealing to? Well, I think one of those is certainly that there's a lot of a pressure in American society that as soon as a woman has a baby, she has to lose the baby weight. That's a lot of pressure. There's also this idea that in order to be a good mom, we want to be healthy. We want to be at an ideal weight, so to speak, whatever that is. I'm using air quotes. You can't see me right now. But that's definitely the kind of message that Jessica is looking to appeal to in this ad. So she's that girl next door. She's relatable to people. And she brings up these issues about being a mom and what that means in terms of her weight. And so it appeals to some of those social norms that other women watching that commercial, particularly other moms, might be experiencing. Now I want to show you a different kind of approach that's been taken, still within this idea of a consumer-driven approach. And this is an ad that came out several years ago by Fitbit. We'll go into that one right now.
Go fit, flip fit, kiss fit, hit fit, split fit, hit fit, flow fit, grow fit, spin fit, street fit, fly fit, work fit, push fit, pull fit, hug fit, wow fit, girl fit, stay fit, life fit, left fit, it's all fit, it's all fit.
Okay, so the idea behind the Fitbit ad and why I wanted to show you that is because here again, they're appealing to social norms, but in a slightly different way. They're saying, look, fit and being fit is what you make of it, right? Like your fit is different than the next person's fit. And it's honoring this idea that we should all be excited about fitness and incorporating fitness into our life because, of course, the slogan here is find your fit. So whatever that is to you, let Fitbit help you along that journey. Let us help you to be able to get healthier and to get fit and help, by having an ad like this, they're kind of showing us that hey, they recognize that what my version of fitness might be still counts. Whether that's playing with my child, lifting weights, going for a bike ride, whatever that is, it's important and it matters. And look, I see other people doing it too. So those are examples of a consumer-driven approach that's sometimes taken in social marketing. The third kind of approach that's taken is typically for more broad-scale campaigns. It's called a market-driven approach. Market-driven approaches are often looking to counter and have an influence on really broad societal and cultural influences that are really, in many ways, either promoting poor behaviors or just normalizing poor behaviors. And one of the best examples I can think of for these kinds of campaigns is the It Can Wait campaign, the texting and driving campaign, which was initiated by AT&T many years ago. And when it first came out, it included things like commitment contracts, where you could go on their website and you could sign a contract for your family that you weren't going to text and drive, as well as large-scale educational campaigns and programs that they take to assemblies across different schools across the U.S. And if you go to the website, itcanwait.com, you'll find lots of their kind of social marketing materials that they've made up. But one thing that I think is really unique that this particular big scale marketing campaign has done is they've created a whole bunch of vignette videos. Videos that are intended to help people really think about the impact that can happen from distracted driving and from texting and driving. And they're a little bit longer, like they're not shown in, 30-second commercials on television, but they do get shown in hospitals, doctors' offices, assemblies across the US. And I just thought it would be cool to show you an example of what that might look like. So here's one example. It's about 6 minutes, so hang with me. I think it's particularly good. I want you to get a sense for, again, this idea of I'm trying to counter this broad societal or cultural influence, which tells me that texting and driving is okay because everyone's doing it.
All right, gentlemen, you know what's at stake tonight. We win this ball game, we're going to state playoffs. We lose, we're done for the rest of the year. Seniors, you'll never play at Wolfden Stadium ever again. This is your last shot here. You got to go for broke, play for these guys, lay on the line for them tonight. Remember, you call one wolf, you invite the pack. Let's go, Wolfpack for life.
Across field to the 20, cuts it up to the 25, gets a block, gets outside, across the 40, to the 50. Okay. Complete to Clean, spins at the 10.
Not everybody in the world can catch the ball, stop, spin, do the 360.
Fletcher Cleaves at 5'8" is very undersized. He's going to have to work his butt off to play college ball.
That's it. Good drive. Good drive. Good job right there. Good job, Fletcher. That'll win a warning. That'll with the scrum. Stay with the scrum. Stay with the scrum. Good job. Good job. Keep digging. Keep digging. Power. Speeding. Power.
So Jimmy school's out. For most kids, the dream is over. Colleges have nearly filled their rosters for September.
Only a few are going to land a football scholarship at the next level.
Back straight. Power squeeze just the bar. Power squeeze just the bar. Come on, this way. Keep working. Come on, move right there. Good. This way. Come on, get your nut. Out of the way. Good job right there when it finished. Ah!
Hey Fletcher, Coach Freeze here. We're all very excited to have you come play ball at Lambeth for CN preseason.
Last week, crazy, man. Crazy stats. You the man for that. Barley, one-handed grab, spin move. What you go for? 150 and one touchdown? Bridge builders off the chain.
Hey, Flint!
All I saw was the glow from the phone on the other driver's face.
Good morning, sweetheart. This is day 2. Would you like to sit up?
So, Fletch,
T.I. Shannon.
how are you doing today?
Tired. You ready?
Yeah.
1, 2, 3.
I forget to breathe, Fletch.
It's hard.
Nice job.
Get up, get up.
Where we at?
I know. Got a busy day today. Got a million things to do. Places to go, people to see, son.
No, we just been doing stuff all day.
I know what this is. You just started this one. Come on. You got it.
That's number 2, right?
Mhm.
See?
3, 4, 5, 6, 7, 8, 9, 10.
11:04 p.m. Fletcher would like to show us something. Good job, boy. A few months ago, there's no way you could have done that. We're proud of you. Can't keep a good man down, son.
One, two, three, four, five, six, 7, 8, 9, 10. 1, 2, 4, 5, 6, 7, 8, 9. Good job. That's awesome. Proud of you.
What's going on, kid?
I've been waiting for like an hour.
That's what it is? Yes, it is. That means you did something, right?
Get on the floor, work out, lift weights.
There you go. I love you, boy. She's working. What are you gonna do now?
AT&T reminds you, it can wait.
So that's an example of a market-driven approach. And you can tell, right? If you're anything like me and you watch that video, like I have chills every time I see that video. It never becomes easier for me to watch that. And I'm not gonna lie, I'm guilty. I'm guilty of being in my car and glancing at my phone. And I'm not the type of person who you're gonna find texting while driving. But I do text when I'm sitting at a red light. I admit it. I have glanced at a text when I was on the road and I knew it was about where I was going to see how to get there. And so the idea behind this campaign is it's really geared at trying to get us to question our behaviors. And I will be honest and tell you that because I watched that today while I was recording this, that will haunt me and I will be more responsible for a time. And so do these campaigns work? Yeah. Is there research to show that they can help people? Absolutely. Do we have good long-term data? No. But I hope that you will think about campaigns like this and recognize how hard it is to come up with some sort of a social marketing campaign that's totally looking to counter what society is doing, what's happening on the broader influence level. And that's what these social marketing, market-driven approaches are really about. Now, this is not something we're going to go through together, but I provide this to you as a resource because one thing that I want to get across to you is that very often when we embark on social marketing campaigns in public health, we do use different theories to help us guide our targets, the strategies we're going to use, and then help us figure out, who is the best audience for this. And so these are some examples of theories that are often used tied to social marketing campaigns: the integrated behavioral model, social cognitive theory, diffusion of innovation, and the extended parallel processing model, which comes out of health communications work. All of these are frequently used to target people with social marketing campaigns. When we do social marketing campaigns, evaluation is really exceptionally important, and we do that across 3 different places in the campaign. So if you look through social marketing literature, or if you're interested in this, in maybe working in this realm in the future, or even considering this for your paper, what you're going to typically find is that people will present their evaluation of a social marketing campaign in terms of 3 phases: the design phase, the implementation phase, and the evaluation phase. So in the design phase, we're really thinking about the who, what, where, type of stuff. And then we're looking at, what's the real prevalence of this problem across the different groups? How do we figure out what the appropriate channels are, and what have we decided that that's going to be? What are the factors that we think are important for influencing our target audience? With whom do we need to align ourselves? So is there a particular organization that can help us to plan and implement the intervention? And then what we do is we'll do a little pre-testing. So we'll come up with our campaign messages and however we're going to deliver that, whether it's through media and commercial, whether it's through poster campaign, billboards, whatever we're going to put out there. And we'll pre-test it with an audience. And then we'll use that information to better define our market, our product, our price, our place, our promotion, and then we will adjust accordingly before we go into phase 2, which is the implementation phase. And as we're evaluating in the implementation phase, we're often doing what's called a fidelity assessment. In other words, we're looking to see, are the social marketing messages that we're putting out there, is our intervention that we're putting out there, is it actually reaching our audience? That's a big deal. Because if you put together the intervention or the program, but you're not actually reaching your audience and they're not getting the messages, or you intended it to be perceived one way and they're perceiving it another way, that is a big problem. So this is sort of, we do an initial assessment of our impact, and we make adjustments so that we can enhance our reach and make sure that the messages that we're putting out are the messages that we really intend to offer. And then lastly, in the evaluation phase, we're assessing our primary outcomes to determine, was our campaign effective? So are more people using condoms? Are more people getting this particular product that we think can be helpful for them? Sometimes we'll also do a mediator analysis to determine which elements of the campaign are most effective, or a moderator analysis to determine who the program was or was not effective for and what those demographics might look like. And another thing we'll do often is a cost effectiveness analysis. We'll really consider the cost that were put into the program, the social marketing program, and we'll look and see whether enough people were changing their behaviors to really make it worth the efforts and the resources that we had to put into the program. Because if not, we'll want to change it for the future. So in summary, when we're talking about social marketing, we've got a lot of strengths here. We know that it works. There's lots of research to support this, and we know that it utilizes a broad intervention approach. And so because of that, it increases a lot of reach and it has a lot of impact value, which is pretty cool. It's cost effective for some issues because it reaches larger numbers than public health programs typically do. And it encourages the focus on both individual as well as social ecological factors that influence our behavior and our health. So that's really important, and I think that ties in very nicely to what we're going to talk about in a minute with the ecological models of health behavior. It also encourages the utilization of theory to help develop the intervention and guide the messages. It encourages an assessment of fidelity or implementation as well as outcomes. And it encourages target audience participation in the design and implementation, because unless we pre-test and get our audience feedback, we can't know if it's really going to work well. So we'll often go out to our audience and ask them what kinds of perceptions they already have and use that to help start building our program, and then go back and say, these are the messages we've developed. Like, how helpful are these? And figure out what people like and don't like and what's motivating for them before we go out into a large-scale campaign. So that's all a lot of, strength that we can give to this. But the weaknesses are that it's very challenging to test social marketing campaigns with rigorous study designs, because we can never be quite sure how much exposure somebody's had. Social marketing campaigns also take a lot of time and effort and personnel and technical abilities to design and implement. So they're team-based at a level that's beyond typical public health work, and often incorporate a number of different, communication strategists, media strategists, and other folks to be involved on your team. And health behaviors are not always amenable to change the same way we can target people in commercial marketing. Health behaviors are harder to change. So as a target of social marketing, which health behaviors often are, there's no guarantee that you're going to put in all of this effort and it's going to work. But all of that said, I think social marketing campaigns really have stood the test of time and continue to be recommended because they can have an impact, and they can have an impact that's quite significant. So with those elements in mind, this idea that it's important to be thinking about the individual factors that need to go in, as well as sort of the larger group and societal factors, let's talk briefly about ecological models. with ecological models, we're really looking to emphasize that there are environmental and policy influences, as well as social and psychological influences that need to be taken into account in order to promote health behaviors and healthy behaviors. What the main assumption is with an ecological model is that behaviors in health are determined by intrapersonal beliefs, interpersonal support systems, organizational or community access, and environmental issues like a work and home environment, and then environmental and policy issues, which also influence our access to certain health behaviors, as well as laws that might influence certain health behaviors as well. So all of these things have to be taken into account. And the model has often been used to identify not just the determinants of behavior and health, but also to provide a framework for designing interventions and guiding measurements for change. So this is what the model looks like. And what you see is that all of these rings are nested within one another. And if you think about it, this is really important because, of course, we could have all of these as you could think about it. There could be a person in the middle and all of these rings sort of separated around them, but then that really wouldn't be the ecological model, because the ecological model recognizes that these things are not just important individually, but all of these different layers, they interact with one another, they have an impact on one another, and they don't exist in a vacuum. So the ecological model is very focused on how is an individual's attitudes influenced by all of these other layers at the same time. Now, you guys, I am going to show you the cheesiest video on the planet. And I'm also going to tell you it's got spell errors everywhere, spelling errors, oy vey. So this is a video that was made up by a bunch of undergrads. I found it on YouTube. It's cheesy as all get out. But here's the thing, you guys. It's really good. It does a good job at laying out the foundation for the ecological model. So just humor me and watch this absolutely ridiculous, cheesy little rap that these undergrads made up that I think is so cute for two reasons. One, it'll probably make you chuckle. And two, it actually does a pretty good job of laying out the ecological model. So I'm going to show you that right now.
There are many ways that health behavior can be explained. There are many factors, and here's a few to name. There's internal meaning, skills, and perceptions, attitudes, beliefs, and expectations. There's external too, like social support, significant others, consequences, and rewards. There's a model that uses all of these factors. It's called the ecological model, and health is what we're after. It's like an onion because it has so many layers. Robin Werner saw the influences on health behavior. It starts with interpersonal and ends with society. So follow me. Interpersonal deals with personality, beliefs, attitudes, even self-efficacy. Our health is influenced by these factors. Our psychological being, it really matters. Interpersonal is next on the list. This is about friends, relatives, and relationships. This level influences behavior too, because you're influenced by the people around you. Then there's institutional, like rules and regulations, health initiatives, incentives for participation, worksite wellness, and vaccinations. If you participate, maybe you can get a vacation. Okay, then there's community, groups, and norms, and great diversity. Getting involved, volunteering, making changes can greatly be used to society's advantage. Speaking of society, that comes next. This includes social policies and economics. For example, minors aren't allowed to smoke cigarettes because to make a change, a law was put into effect. In summary, behavior influences health. All these factors connect, and they can help determine our health and how we perceive the way that our health needs to be.
Okay, I told you guys, cheesy, right? But hopefully it made you smile. I'm sitting in my desk chair doing my little up and down boppity dance. But here's the thing, it actually does a really good job of laying it out. So let's review the core principles here. That there are multiple levels of influence, and all of these have to be addressed. Now, according to true ecological, the social ecological model, and true purists with this model, in order to properly address any health behavior, you have to address every single one of these layers. In reality, however, I will tell you that it becomes kind of next to impossible to do that. Can you imagine the amount of time and resources that it would take to address every single one of these layers? But on the whole, most people who are using the social ecological model for their work are looking to address at least 3 of these layers at one time in order to promote an intervention to help a health behavior. The other core principles are simply that environment influences behavior, sure, but also that there's interaction across these levels. So we know that, certain laws can have an impact on increasing somebody's desire and motivation to do something. So policy can influence individual behaviors. But we also know that a lot of times community and groups rally and, work very hard to lobby for policy change. So all of these things are constantly going back and forth. And that can either, help to shape or might constrain an individual, behavior. We know that models need to be specific to the behavior. So what works for one behavior might not work for a different behavior. And interventions need to be targeted to the different levels, and ideally should be multi-level, to be effective. So we might need education and social marketing with access and policy support in order to really kind of yield the change that we're looking for. Just a little history that kind of brings us to the point of today's social ecological model is that when these models first started to be discussed, it was really just a focus on the fact that there are perceptions we have of the environment, and that we can broadly use that to help explain some of our behaviors. But that was kind of limited. Some of the later models recognize that environment at multiple levels can have direct impacts on behavior. And this was used to help design and explain, different kinds of interventions for behavior. And there was really more of a recognition of the fact that you had to hit people from multiple dimensions. So you couldn't just say, like, what's somebody's immediate environment and let's change that to influence the health behavior. But you also had to look beyond just somebody's immediate environment and also think about all of the other policies that come into play or the different relationships that they have in their life that influence their environment, that influence their personal choices. So like when I'm working with a nutrition client who really is at the individual level dedicated to making changes in his or her nutrition to be healthier, but they go to a workplace where they're constantly surrounded by junk food or candy jars, or they come home to a significant other who eats really unhealthy foods around them, or they live in an environment that's a food desert and they have a really hard time accessing good quality healthy foods. Well, these are extra challenges that we can't deny in working with our client. And so we have to recognize that there are different levels and bidirectional and multi-directional influences. And so that's what came out of the work in kind of the early 2000s. And our current models are really more on emphasizing the role of the interaction between people and their environment, placing a lot of significance on the interpersonal factors and somebody's beliefs with the environmental level factors and the policies that are, surrounding them. So for example, if you thought about an effort to try to increase flu vaccine uptake, and you wanted to approach this from the perspective of the social ecological model, you might think about at the different levels how we might, get some messages out there to intervene. So for example, at the interpersonal level, we're going to look to increase somebody's perceived risk for getting the flu so that we can ideally have greater vaccine efficacy. And we obviously want to work on constantly lowering vaccine risk for people. So that becomes an important thing at the interpersonal level. At the interpersonal level, we take into account, that we might want to try to get a greater number of people in somebody's social network vaccinated, because if we can do that, we can have a greater influence on them and the likelihood that somebody will get vaccinated. At the institutional level, we want to have greater information about vaccines, and a belief that the doctor thinks vaccines is a priority can have a really important influence on, for example, a health practice. And if your doctor thinks that vaccine intake or uptake is a priority, then when you go for your appointment, your doctor is going to mention this and say, hey, when's the last time you got your flu shot? And if we think about even in our workplace, having things like free flu shot days and flu shot clinics that are available for employees, this is all stuff that at an institutional level can make a difference. At the community level, we might be looking to emphasize greater risk. So maybe there are problems with flu in a certain community. Maybe there are a lot of community members there that are struggling, or there's a particular geographic area that was hit really, really hard last year. So if there's worry in the community, if there's issues about school closings, all of this might influence somebody's decision to get a flu vaccine. And lastly, we can't ignore policy. So we've got to give people access to insurance and identify those people who are in the priority groups to get the vaccine and make sure the vaccine is accessible to them and affordable to these folks so that they're more likely to get their flu shots. Another place that this really kind of gets incorporated is when we think about the number of people out there that are working in community development and the built environment. And when you think about it, really, every time you step out of your door every single day, you're influenced inevitably by the community around you, and that's influencing your health and wellness. So the amount of, for example, open space, safe open space you have access to, the amount of access you have to healthy foods, medical services, to the ability to be able to get around and transport yourself, to live in a quality and affordable house, to have economic opportunity, to be in a safe neighborhood with safe public spaces, in a good quality environment where you're not being exposed to toxins constantly, and to be able to participate in green and sustainable practices. Well, all of these elements influence community health and wellness, and therefore all of these elements influence your wellness. So we don't live in a vacuum, and the social ecological model is really big on emphasizing these elements. This also comes a lot in community building and landscape design, as well as overall urban design. Thinking about how, for example, what you see on this little infographic, like some cities have 10 times more pedestrian and bicyclist fatalities per pedestrian and bicyclist commuters than others, largely because of how the landscape is designed. We know that children are more physically active when they have schoolyards that are open for public play, and the people who live near trails are physically active. So when you think about all of these different things that we can incorporate into urban planning to promote health without you even having to think about it, just because you're lucky enough to maybe live in an environment where you have access to these things, well, inevitably, that's going to influence the kinds of behaviors that you choose. And when you do choose to become healthy, if you have access to these areas, it's going to help make it a little bit easier. So the social ecological model simply emphasizes that. So in summary, the strengths of this are basically that we can help utilize a broad intervention approach to target multiple determinants of health and behavior, and therefore it can have a lot of reach and a lot of value. But the weaknesses of the social ecological model are that, again, it's challenging to test this with rigorous study design, so it's open to a lot of confounding factors. It takes a lot of time and effort and personnel and technical abilities, again, to design and implement something with this model. It's also really difficult to isolate the effects, at the individual layers and variables across the levels of the model. And it's a conceptual model, not a theory per se. So it doesn't give us sometimes the same level of guidance that some people might want in designing an intervention. So what questions do you have about social marketing or the social ecological model? Please bring them to class. We'll take a little bit of time before our final exam review to do a quick recap and assessment of this talk, just to hit some of the big points and to make sure that you are all caught up to speed. So thanks again for listening to this lecture online, and I look forward to seeing you in class. Take care. Bye-bye.